Big breath in and close your lips. Ooh. Oh, wow. Oh, wow. Wow. So we have Tanya here today, and I'm excited to help today with your case because it's different, it's interesting. What is your reason for coming in?
Well, I suffer from sleep apnea, so
Okay.
I snore pretty bad. I also have trigeminal neuralgia on the right side of my face.
And I'll talk about that in a second, so don't run to Google yet.
So I also suffer from migraines. So at least at this point it's about once a month, which isn't bad, but it's been worse. And I have constant sinus pressure, so I'm always, holding my nose and popping my ears just to feel like.
And you had surgery on
breathe.
that?
I did.
15
15 years ago,
Yeah.
I had sinus surgery, which was not fun.
Okay.
The recovery in and of itself.
So one of the things is you saw some of my videos and you're thinking maybe you would try the CFR today, correct?
Yes.
Okay, so let me speak a little bit about trigeminal neuralgia. There's a lot of different names for it. When I was in school, the proper name that we learned from the textbooks was tic de la rue. I like the word trigeminal neuralgia. It's a little easier than tic de la rue. There's also Fothergill disease, and it's also sometimes called suicide disease. And the reason is if someone has it with unrelenting pain in the face, that like yours comes as little lightning bolts and then disappears.
Yes, it literally feels.
But imagine if it was
tased.
24/7. Oh, she says it feels like she gets tased in the face, and you had it as recently as yesterday.
Yes.
How long does the tasing feel?
Usually a couple of seconds. It's usually not long, but it can come back to back, or it can be once, and then it can be, maybe another 20 minutes before it happens again. Maybe I'm chewing something or drinking something, sometimes just speaking, and it's just jolting.
And it's horrible.
Yes, it's awful.
Like being tased in the face. So some people get it so bad that it never goes away. They're being tased constantly. They do drastic measures. They take narcotics, they get the highest level of prescription and pain medication. They eventually might be open to getting that nerve severed surgically to just paralyze the face, but then you won't feel the pain, but you won't have control of your face anymore. Your face will droop. Now my teacher, Dr. Adam Del Tordo, that did CFR for 25 years in his practice, he's retired now and just teaches, he did work on some cases with CFR with tic de la rue or trigeminal neuralgia over his 25-year career, and he said that it will work on many cases, but it takes a lot of visits. Okay. It takes 10, 15, 20 visits sometimes, but he's turning cases around, even long-standing and really severe, horrible cases that were unrelenting pain. So if it turns out that you think we're onto something, you're going to have to probably do more visits, but let's see what we can do to help you. So unless you have any other questions, let's get cracking.
I'm ready.
So I just asked her how many years she's had the trigeminal, and you said at least 6.
Yes.
Ooh, did you hear that?
Mm-hmm.
I didn't even mean to do that. It just cracked, like 3 or 4 cracks just from compressing right here.
Mm-hmm.
Even though it shocked me, it's not a total surprise because, I've been doing this for 25 years, and before that I was a massage therapist for 8 years.
Oh, wow.
So it's a long time that I put my hands on people's bodies on a daily basis, and I kind of get a sense of where my hands should be. So it's not an accident my hand's here, I just didn't think it was going to pop so much. Plus I didn't put a thrust into it. No, I just lined up on it. But I am on a key spot on her. So I'm just on her lower back here. Let me start stretching her on this machine. Do you have a headache today?
I do not, thankfully.
Big breath in and blow it out. Ooh, that was good. Big breath in and blow it out. Ooh, that was 3 more. Did you feel that one?
Mm-hmm.
How did that do for you?
It feels tight and then it's loose.
And it feels loose now? Good. All right, let's do some more, okay? I'm gonna actually have you come, actually before you do anything, turn your face, this direction is to the left. Now turn all the way to the right. Was it harder to turn left or harder to turn right?
Harder to turn left.
Okay. We're gonna do that spot next, okay?
Okay.
You're gonna sit up right here like this. Okay? With one butt here and one butt there.
Okay.
If you know what I mean.
Gotcha.
Did you say Ote?
Yep.
Did you like the Little Rascals?
You know what?
That's
they
where
were
I
part
heard
of my growing up.
Me too. Scoot forward. So I'm going to try to release that horrible spot. This could help your headaches too, okay? Because this is the occiput. Let's see if we can get a good one. So you're going to drop your head this way. Big breath in. Drop your back into my knee. Oh, wow.
Wow. I feel lighter. Like is that?
Yeah, that's what would happen if your whole head was crushed on your neck, which yours seemed to be.
Yeah.
Let's see if I can get more in that neck, okay? May I move your hair?
Go
Do I
right
have
ahead,
permission?
dude.
Thank you. Just a little one. And there's a little more. Whew. Whew. All right. Now I'm going to have you lie on your back. Put your feet out like this. So do one more in the middle here. And one here. Those are good. And I do want to do a little bit of a Y strap on you today. Because I feel like you have a lot of compression and this might help the headaches. I don't know if it'll help the trigeminal neuralgia, but it should help the headaches. All right, so drop your head. And we're going to just stretch you straight back, okay? Big breath in and blow it out.
Oh, wow.
Whew. What did you feel?
I felt the crack.
I heard the crack.
Yeah, I heard it too. Yeah, I don't feel like much stiffness.
Okay.
Whereas before, I always feel tight.
Okay. Good. Lie on your side facing me this way.
Facing you?
Okay, good. So now, your hips are good. That's not your problem. So we're now going to do the CFR. She's got trigeminal neuralgia, which means face pain, that to her she describes on the right side of her face, and she had one yesterday. Feels like she's getting tased in the right side of her face. She gets chronic migraines. She has sinus issues, snoring issues, sleep apnea issues. She's a great candidate for this, but I told her it does take many treatments if this is something that she wants to work on, but she'll see a progression each treatment, which is really cool. Big breath in and close your lips. Perfect. Wow. What did you feel?
The same pressure release as though I clamped my nose in.
Like on a plane when we do
I
that?
felt it in my ears. Wow, like now I can feel like I can literally breathe clearly through the left nostril, but the right still seems like a struggle.
And that's the one we're going to do next.
Oh, wow.
Now, where in the face did you feel it?
I felt it like right about here.
Okay, good.
And like into my ears.
Okay, good. So now let's see what the right side does for us.
Ooh.
You ready?
Yes.
Okay. This side's clearly more difficult. I felt a lot of constriction and pressure. Big breath in and close your lips.
Ooh. I actually heard cracking, and I felt it, like, I don't know what part of my sinus
but
cavity
up
it
in
is.
there.
Yeah.
Now take a breath. Let me get your fresh box of tissues. And we'll have Floppy right by you in case you need Floppy, okay?
Thanks.
You're very brave. That's hard to do that. When I've had this done to me, I've had it done about 12 times now.
Wow.
And each time is difficult. Like each time I'm like, whoa.
The
It's
anticipation
crazy.
was
Yeah.
honestly
It's
way
intense.
worse
than
the pain. It felt maybe, like I went underwater.
Mm-hmm.
I get water in your nose, so for a second you feel you can't breathe, but it was very quick.
I think most people describe it that way. They say it's like you jump in the water and the water just like shoots up your face and creates an incredible amount of pressure. And then it's boom, it releases. Thank you for doing this today. What was your favorite part? We did the Y strap. We did all sorts of stuff.
Honestly, everything.
Okay.
It's something, I've been to a chiropractor once before, just had some basic adjustment, but you took your time, felt your way through, I felt comfortable. You talked me through what you were doing, so I was aware and understanding.
Okay.
The Y strap I've never done. So that one was, I think, the most intense.
Yeah.
But I felt
Oh, how about
the
the
release.
The occipital lift where we lifted your head.
Yeah.
That was good too.
Listen, I'm glad I came. I
All
was
right,
very
good.
nervous.
All right, thank you so much. And we'll see how you do.
Okay.
All right, great.
Thank you. Oh, wow. Wow. I feel lighter. I think it's that.
Yeah, that's what would happen if your whole head was crushed on your neck, which yours seemed to be.
Yeah.